Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, today we're going to talk about something really cool. Lunchtime facelift, the lifting your face on your lunch break, a non-surgical facelift. All of these things have been used to describe what we're going to talk about today, which is called the thread lift. You may have seen pictures of this on Instagram with these pink little needles coming out of people's faces. Usually on Instagram, there's 30 plus of them hanging off of people's face. And although that's part of thread lifting, there's so much more to it than that. So today I have Samantha Bauman with us, who's one of our nurse practitioners, and a special interest of hers is aesthetics. And she also does thread lifting in our office. In fact, she was one of the first people to actually experience thread lifting herself as a patient in our office. So today, Samantha and I are going to just chit chat about thread lift, and hopefully you'll find this conversation informative. So welcome to the podcast, Samantha.
Yes, thanks for having me.
Yeah, so before we get started, some people might not even know what thread lifts are, or what is the science behind this, and how does putting literally a thread in somebody's skin make it aesthetically more pleasing?
Yeah, so obviously I'm sure that's the question everyone wants to know is how does this work? So threads are a relatively new form of what we call a non-surgical facelift. So if you have that loose sagging skin and you want that tighter, more lifted, youthful look, this is a great treatment. It's kind of a middle ground therapy between filler and obviously a surgical facelift. And basically it's a suture thread that's placed underneath the skin. It's relatively low pain, minimal downtime, and it is overall just an effective way to create, that natural, youthful looking face. And you can even do different parts of the body, whether it be above the knees or under eyes, neck. You can do it all over. The science behind it is the threads are a suture material that have a long and safe record. They've been used in a surgical setting for many years. They're biodegradable and absorbed by the body over time.
Yeah, so these threads don't stay in place for forever and ever. Your body actually gets rid of them over the next couple months.
Correct. That is correct. And there's different types of threads, and if we go in and talk about each of those in a little more detail, some of them are absorbed, a little quicker than others. But yes, over time they're, they dissolve. And basically the science behind it is that it stimulates neocollagenesis, which, produces collagen, therefore giving you that tighter skin, more plump skin. It diminishes fine lines and wrinkles. And even after the threads have dissolved, it still does that that collagen stimulation.
Yeah. So in general, there's two kinds of threads. The lifting threads, which is, that non-surgical facelift. And then there's the foundation threads, or the stimulating collagen. So for the lifting threads, what kind of result are people going to get? Because we certainly don't want to say that this is going to replace a facelift by any means.
Correct. So generally, as we age, we the fat deposition in our face begins to sag, and kind of gravity takes over. And rather than it being in our mid face, it wants to migrate down towards the jowl area, or kind of near those nasolabial folds. And the lifting threads, have actual barb kind of the thread itself is sliced a certain way that it allows lifting. Once it's placed, it lifts up the soft tissue and kind of repositions it in what we would say a more youthful look. So it kind of takes it from that lower face and mid face and kind of plumps it back up to where it once was maybe 10 years ago. In general, as a rule of thumb, they'll say that it'll lift skin, usually about 2 centimeters.
Yeah. And you'll get a little bit of an immediate result, especially when you do one full side of the face and compared to the side of the face that wasn't done. But the full results aren't immediate, are they?
Correct. So, some will tell you get by 6 weeks, you have pretty good results. But in general, by 4 months, you're going to see the full effect. And, and like I said, even after the threads have dissolved, you're still going to, stimulate collagen production. And so, yeah.
So for these lifting threads, where exactly in the face can you put these to see lifting?
Yeah, so you can do, a variety of things with them. And I feel like people keep getting more and more creative with, finding new places to put them. But the common and most popular places are an eyebrow lift. And then mid-face that, we kind of, like I talked about, when you have gravity take over and you want the to lift kind of the jowling area or those nasolabial folds. You can do it there. You can also do it under the neck, more targeted for the jowls. Those are really the most popular areas
to lift. Yeah.
To lift.
So then let's switch gears and talk about the other big class of threads, which are the foundation threads. And I think those are the main ones people see all over Instagram. They're typically kind of have a pink outer shell to them. And you see people with, 10, 20, 30 of these things in the side of their face. So let's explain to people what those are used for.
Yeah, so those are primarily kind of, what we talked about are to stimulate, a collagen production. And how it does that is by your body or your skin triggers cells in your body is called fibroblasts that produce collagen. And there are 2 types of the foundational threads. One they're mono and they're smooth, and they're just free floating threads that, truly their sole purpose is just to produce collagen. They're usually absorbed in, 180 to 200 days. And then the other type of foundational threads are the twist threads. They work very similar to the smooth ones, except for these actually can feel like a volume deficit. So they kind of have a spiral appearance, and they create like a macrophagic response, and therefore they actually have a more effective means of stimulating, like I said, a volume loss and stimulating collagen production. And so those are, really
so the
what
twists
those are.
Maybe a little bit better in certain areas.
Correct, especially when you have those areas where you have volume deficits,
which most people do.
We
as
do,
they
yeah.
age.
After
maybe not
age
that person
30.
that's a little chunkier who doesn't need volume, but for most people that age, and that's why we're putting filler in the face, is they do need a little bit of volume in the face.
Yes.
Versus the mono ones don't give you volume. So when we're doing a neck lift, we'll put those underneath the skin of the neck because we don't want more volume in there. In fact, sometimes we're injecting some medications like Kybella to actually remove volume.
Correct.
Under the skin.
Yes.
What about, let's tell everybody about some of the, at least with the company we're using, there are some specialty threads.
Yeah, absolutely. So some of the specialty threads that we have or that we use and we're treating are under eyes. The under eyes are a big area of concern for a lot of people. And the under eye threads are, like she mentioned.
Not a lot of people. I think everybody. Like even these women that have great skin, like that skin under the eyes is just so thin, and it requires a lot of maintenance to keep that up. Really, I think everybody over at 40 should absolutely be using an eye cream, maybe even starting at 30, because that's when you start to lose collagen. But then when you are getting older, even when you have great skin, it's just so hard to, not let your eyes age you, especially these days when we only see people's eyes because we're walking around wearing a mask.
No, you're exactly right. That's all I can seem to focus on is my eyes. And so you're absolutely right. And I think that the under eyes, this is a great treatment for them because filler is a little tough to put and fill that deficit. People, sometimes you can get great results and sometimes, you can't. And so these are a great alternative to trying to help, with those under eye, fine lines, wrinkles, that kind of, texture that we don't like, and just the overall appearance, dark circles even. The under eye threads are a great alternative.
And we could put some of those twist threads under there if people have some volume deficit.
Yeah.
I agree with you. I think putting filler under the eyes is really difficult. Like you you pretty much always bruise. I think it's difficult to get it quite right because that skin is so thin versus these threads are microscopic and just do their work naturally. So you're never going to get overfilled. Our eye threads are blunt, so it's really difficult compared to filler where you're putting a needle there to bruise. And so there really isn't much downtime.
Yeah. I mean, the bruising can happen, but like you said, it is, few and far between. And these little threads are like the size of a hair. So, even if you do have one or two that, maybe you think you can see, we have ways of working around it. But in general, these threads are a great option, for treating the under eye because they're so fine and thin. And you just usually under that thin skin, they don't show up and they don't bother people like filler.
What other specialty threads can we tell people about?
So another common area that people, really want fixed are those nasolabial folds. Filler is another option for that, but another quick and easy and much quicker and less risk of, adverse reaction is we have a specialty thread, and it is we call it a multi-thread or a broom thread. And so it has multiple threads in one little introducer, and it's great for filling those nasolabial folds and pumping it back up. And you can use the same thread in like the temples. So a lot of women as we age get that volume deficit in the temple area, and that's another great place to put that multi-thread in.
Yeah, you mentioned, I'd probably say the most common thing people use for the nasolabial folds is putting filler there. And what's really nice about filler is it's immediate. Unfortunately, we both know that threads, like you said earlier, the full result takes a couple months, but some people have really deep threads or really deep nasolabial folds. And so for those people, sometimes it's a combination of they might need a little bit of all of it, the lifting threads to pull up on the cheek, a little bit of the specialty broom threads, and then topping it off with filler.
Yeah, absolutely. And I think that's something important for people to understand in general when it comes to aesthetics is, a lot of times it takes multiple different things to really achieve that look that you want. And so you're absolutely right. When, the threads in the nasolabial folds, sometimes filler, combining threads with Morpheus is a great option. And obviously Botox is, you can't dismiss that in any way. There's nothing that can really fill that void. So doing a combination of all of those treatments is, usually what people need to kind of get that, overall desired look. But all of it helps in some, different realm. And so, yeah.
Yeah, I always tell people it would be great if you could just step into this box and step out of it and you look like a supermodel from head to toe. And there was just this one thing, or what's the one thing I can do? But Unfortunately, life doesn't work that way. And there's not one thing for really any problem. There's not one supplement that I would recommend. There's not one thing I would recommend for weight loss. And same thing with aesthetics is there's never just one thing. And I think you said it well, is I agree with you. The Morpheus, and well, I'll probably have to have you explain what Morpheus is, because I don't think we've talked about that yet on the podcast, but that's an amazing rejuvenation procedure. And then follow it up with some threadings. Like, you're almost getting close to kind of facelift kind of results with that. But since we haven't talked about that, do you want to tell people what our Morpheus is, just in general, just high level overview?
Yeah, so I mean, very generally speaking, it's radio frequency microneedling, and the goal of it is just, it's best used in a series of 3, and the overall goal of it is to kind of help tighten your skin, again, producing collagen. If you haven't heard me say that word enough during this, you should know that collagen is, very important, a very important component to keeping youthful looking skin. And we stop producing it after the age of 30. So all the things that you can do to help, continue producing collagen is what you want. And so Morpheus is a great way of doing that as well. And the purpose behind, doing those therapies doing that therapy, like I said, is to help tighten skin, diminish fine lines and wrinkles. The radio frequency also helps destroy some fat cells, which I feel like some people really like. I mean, depending on the depth that you take the microneedling to, it can kind of be titrated, per patient's needs. But that's kind of a very
good summary.
That's my short and sweet summary of Morpheus. Yeah.
So I've actually put the threads in your face along with Dr. Tiemann in our office. So you've had it done. I keep telling you, like, I need the threads under my eyes. We're both just too busy. I need to track you down. So it's my turn. So I personally haven't felt what the threads feel like, but you have. So what does it feel like? And what's the downtime for this kind of procedure?
So I'm sure that's, everyone probably, I'd say at this point, that's everyone's question is, what does it feel like? Does it hurt? Because I know that when I've had a long-term interest in aesthetics in general. And I remember watching threads on, Instagram or YouTube and thinking, oh my gosh, that looks terrible. Like, how could people do that? And the truth is I love doing them, and I really was curious about them. And I'm a person as a provider that I feel like I am a better provider if I have something done myself, because I can relate to the patient better than. So whenever we started doing threads, I was like, I absolutely want these, so I know what to tell people. And it is not completely painless, but it definitely is not something, I wouldn't bat an eye to do it again.
Yeah, you didn't tell me to stop, that it was too uncomfortable.
I think the only thing that bothered me was the anticipation of, is this gonna hurt? You maybe felt a little, every now and then you would kind of, feel a little pinch here or there. I do know that when we kind of have a new numbing technique that seems to be working very well, and no one, I know the last patient we did, she didn't bat an eye. Yeah. They just laid there and had a conversation, and really said she had no pain whatsoever. When I did mine, we did minimal numbing, and even with minimal numbing, it was completely tolerable. And I would say the downtime, I wouldn't really even call it downtime. It's just more of I can tell I did something on my face. Yeah, you knew
you had something done. It's not we didn't just wave a magic wand at you.
Yes, no. And so that was probably every bit of 2 weeks that it took for me to, after 2 weeks, I'm like, oh, I can't tell I had anything done.
Yeah, but you still
during
worked,
that time, I worked. The next day, I went out in public, and
and nobody's looking at you.
No one looked at me like,
what did you
happened?
have done? But you could feel like you had something done. You felt a little sore.
Exactly. little sore. I think the big thing is knowing, you're afterwards you can't open your mouth really big, and if you do things to your neck, you can't turn your neck, quickly and rapidly.
You can do it. We ask you not to do it.
Correct.
So those are some of the things that, if somebody's thinking of doing this, how do you prepare for it? Kind of like, if you're going to get the Morpheus, you're going to want to stay out of the sun for a week afterwards. But what are the expectations of what people need to know afterwards?
So leading up to it, kind of to answer that question you mentioned briefly, anything that really is going to cause you to bleed. So, obviously alcohol, 3 to 7 days, I would say, before the procedure, omega-3s, Advil, Motrin, asprin, things like that, 7 days. Avoid those before.
You're not going to bleed a lot, but those things just make you make you bruise a little more.
The bruising is, and you want to limit that, I'm sure, on your face.
So anything you can do. It's not that if somebody said, I had drinks last night, I wouldn't do it. You might just bruise a little bit more than you would if you didn't have a couple drinks the night before.
Absolutely. That is exactly correct. And then as far as afterwards, we kind of talked about it. You might have some bruising and swelling afterwards. It is minimal. And usually, ice helps take it down. If you had excessive swelling, we could always do, a prescription of a steroid or something. But usually ice is usually enough to kind of help calm any immediate swelling you might have. And then the big thing is the over animation of your mouth and the, turning your head. We just ask that you don't do that because. And
why is that? Why can't I open my mouth real wide or?
Well, it can kind of ruin the placement of where that thread is. And, especially when you're doing the lifting threads, we want you to get the facelift effect. And if you exaggerate it, it can kind of move that thread.
To stay where they are.
Yes.
So, And then one last question, and we can both get back to seeing patients, is how long can we tell people that if they get this, that they're going to appreciate their results for?
Yeah, so that's a great question. It does. There are 3 different suture materials, which, for the most part, in general, we use, one of them. And the results are usually 18 to 24 months. There is a different suture material that's known to last a little longer. And that one lasts, it can last up to, some people will tell you 2 to 4 years. But you have to, we have to kind of assess the patient, determine where they want the threads before we would determine if they could use, that type of material. But generally speaking, 18 to 24 months.
Yeah. But then the other thing is we're not frozen in time. So we're still continuing to age during that 18 to 24 months. So, and like you mentioned earlier is, it's all about building collagen, and usually we want people to be doing other things like you mentioned, like Botox or skincare or other things to continuing to be working on that collagen, because we're not frozen in time and we're always aging. Yeah. My dad said to me once when I tell him, I did this and I did this, and, I'm going to be 52 here in less than a month. And my dad's like, Amy, when are you just going to give up? It's a losing battle. You're aging. And I'm like, never. Never.
Never. That is my answer too.
Never.
I'll keep trying it all.
Yeah. All right. Hope this helped. Hope you learned something about our lunchtime lift. You know the thing. Like, subscribe, leave a review. Thanks for listening.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.